most graduate medical education is funded by taxpayers. So how can taxpayers get a better value for what we're paying? In other words, how can we bring doctors into more rural parts of the state?
Catherine, that's a fascinating thing you just said, because I can tell you I had no idea that we as taxpayers were helping to pay for the training of doctors. So I apologize for my ignorance on that, but do people even realize that?
No, I think a lot of people don't realize that. And in fact, Congress never really started appropriating money for graduate medical education. That is where physicians go for residency training and clinical education at hospitals after they complete medical school. This all really started happening after the World War II era. And for the most part, beforehand, hospitals paid for residency slots themselves. And actually, this funding was supposed to be temporary until
this was World War II.
Yes,
temporary. Right?
Yes, right. Yeah, it was supposed to be temporary. And the Veterans Health Administration, they also provide some graduate medical education funds, and so does, other federal agencies as well.
We're talking about federal money here.
Yes,
then, right?
For the most part, most graduate medical education money comes from Medicare. However, when we're talking about the subcommittees that were held last month, for state taxpayers to get better value for how we're spending these graduate medical education dollars, some of it also comes from Medicaid, and that's where we're looking at how taxpayers can get a better value at the state level, because that is jointly funded by the state and federal government.